On Kauai, the historic county building is being lit in pink throughout October for Breast Cancer Awareness Month. The annual campaign aims to increase awareness, especially the importance of early screenings. Every other Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the info for you and telling you what you need to know to keep you healthy. Dr. Kalani Brady joins us now from the John A. Burns School of Medicine with this week's topic, which is breast cancer. Good morning and welcome.
Good morning, Christine.
First of all, tell us more about breast cancer and what exactly it is.
First of all, breast cancer is the second most common cancer after skin cancer in terms of occurrence in women. It is also the #1 cause of cancer death in women around the globe. So in the world, breast cancer is the most common cause of death for women.
A lot of people might not know that.
Right.
Okay, so what are some of the increased risks?
Well, there's a whole list of them. First of all, if you have a history of previous breast, ovarian, tubal, or peritoneal cancer, you are at increased risk of a new breast cancer. Also, if you have a family history of breast, ovarian, tubal, or peritoneal cancer, you have an increased risk of new breast cancer. Ancestry is important. Ashkenazi Jews have an increased risk of breast cancer, and genetics are important, which is also ancestry. There are BRCA or BRCA1 and BRCA2, which are genes that increase the risk of new breast cancers, and there are other genetic mutations which can increase the risk. A history of a breast biopsy showing atypical hyperplasia is also a risk of breast cancer, and radiation therapy to the chest for thyroid disease, or more commonly these days for Hodgkin's lymphoma between the ages of 10 and 30 increases the risk. So these high-risk women have different, more stringent recommendations for their screening mammography than the average risk women.
And right now we're seeing people getting mammographies and screenings. For younger viewers who might not know what they're watching, talk about how young you have to start getting these screenings and how often.
You should probably start talking with your doctor when you're 40 about the risks and the benefits of screening. There are false positive mammograms, and so a lot of organizations, including the American Cancer Society, don't recommend starting earlier than 45 anymore. And at 45, the American Cancer Society recommends annual screening until 55, and thereafter one every other year until 75. Once you've reached 75, they say that if your life expectancy overall is more than 10 years, you should get screening every other or every third year.
What if you are young, in your 20s, but you've had a relative, family history of breast cancer? Should you get screened earlier?
Yes, then you should talk to your doctor about the benefits of mammography. Now, screening is important to say that mammography is the screening. Some women think, oh, I can get an ultrasound as an alternative. That's not really true. Ultrasounds haven't been shown to have the pickup that mammograms do, and also MRIs of the breast are used as a follow-up test for mammogram, not as an initial screening.
What about some treatment options for breast cancer?
Well, the good news is that if you catch breast cancer early, the treatment has resulted in a decreased death for breast cancer since the 1980s. So these days, early breast cancers caught, you can get a lumpectomy and radiation locally, and it's just as effective as an entire mammogram. So you don't have to get a mammogram. That's something you can talk to your doctor or breast surgeon about. That's part of the treatment. And then we do a biopsy of the lump, and if it's breast cancer, we test for hormone receptors. And if those are positive, there are a lot of low side effect hormones that you can take from your doctor that will affect your life expectancy, your survival from breast cancer.
Okay, and we do have to wrap things up. And I know we've been showing video of women, but we do want to remind everyone out there that men can also get breast cancer as well, right?
They can. It's related to the amount of breast you have. So it's rare in men, but it does occur.
All right, thank you so much, Dr. Brady.
My
for
pleasure.
Such an important topic and reminder.